This patient came into our office. His chief complaint was that he had a couple of chips on his front teeth. It was bothering his tongue, sharp to his tongue, but also how it looked. The single most important principle guiding my approach is to make these composites look beautiful for the patient. The patient's chief complaint was his smile, and it didn't look right. So we wanted to make his smile even. We wanted to make the fillings look like they're invisible, like there's nothing there, and we want them to be functional. So watch till the end of this video, because you'll see how we can transform a very visible problem with his anterior teeth that created a problem with his smile. So watch to the end so you can see how we can fix this simple problem without anesthesia within a very short amount of time. Patient was in here and out within 30 minutes. It turned out great. So one of the things that I'm always concerned about these very thin anterior composites is that they have the potential to chip. A lot of people will get these done and then the dentist will not understand or take into consideration the functional movement of their jaw. If the dentist doesn't understand this concept, they'll walk out to their car, and the first time they move their jaw forward when they're chewing, that will pop off. Anterior composites, these little thin ones on the top, are famous for not staying on. Even if the dentist knows how to do it right and everything was done right, they still have the potential, as you functionally chew with these, they have the potential to pop off. Now, one thing I always tell patients when I do these little thin composites, these are basically non-chewing teeth, in the sense that they cannot chew a carrot, they cannot chew beef jerky, they cannot chew hard French bread, they can't chew anything hard like that, because when the prying motion occurs on these little tiny composites, they're always going to pop off. So these little teeny tiny composites, while cheap, quick, and effective, they are also not long-lasting and durable. The hardest part of this case is truly getting the aesthetics exactly looking like it's like the tooth around it, using the correct material with the right translucency, and then creating the correct contours. Understanding this is more an educational thing. Understanding the science of how the tooth contours are supposed to actually look is such a huge part of this. And then understanding the material science on this material is really, really important. So when I'm trying to create a beautiful composite restoration on an anterior tooth, I first do an assessment of the person's smile. How much of the tooth is missing? How much of it actually needs to be rebuilt? If the material will not support the construction, then we have to go to something different. And sometimes you have to just say, no, I can't fix this with a composite. But this was easy to fix with a composite. Not a lot of his tooth structure was missing. But the number one concern in trying to make this work right is understanding how teeth are shaped. So when I look at this case beforehand, I take pictures before, look at those pictures and see what's actually going on with the tooth structure itself before I start. Then I try to create an ending that looks exactly perfect for the patient. All right, some of the constraints with this particular case is where it's at in the front. Composite materials have to stay absolutely dry. So we are using a retraction device to be able to make sure. Some of the other things that are a big challenge with this case is getting the translucency in this material to match the tooth exactly. So this case has some challenges with it material-wise. Trying to keep this material and build this material out so it will be strong, long-lasting, and durable is also a function of how the patient's jaw moves. So we're focusing really closely on how his jaw moves across his front teeth and making sure that there are no interferences to knock that filling off. So this material and choice of materials is very affordable and it's moderately lasting, but the best choice for this particular case would be a veneer, an all porcelain veneer. And so we're going to probably do that for this patient in the future. But this is a really good option, quick, fast, and easy, and cheap. Okay, so the preparation portion of this successful composite restoration is really the foundation of what we're doing here today. So the preparation has to have a minimal reduction in the enamel, but also put these blended angles in so the composite looks like it disappears. A common problem with most dentists that are doing composites on the anterior is they're choosing a material that's too translucent or not matching the translucency of the tooth, and then they are not blending the composite into the tooth structure, so they don't have a long bevel to hide the composite. So you want something that's going to blend in with the right opacity, the right color, and then have a long bevel that will actually fade into the tooth structure. So in this part of the composite placement is actually getting a really good bond between the tooth structure and the composite itself. So preparing it, we put an acid etch on the top, which creates these microtubules etched into an open microtubules in the crystalline structure of the enamel. Then we put a special type of bonding agent on the top and make sure that it's thinned out and then light cured appropriately. This bond has to stay absolutely dry as you put the composite on. So we place the composite on the bonded surface and then contour it out to the way that we want it. And then after that's done, we go back and we smooth it down so it looks exactly like the other teeth. Then we go in and use a special type, 2 or 3 different types of coarseness of polishing agents to actually make it look smooth and reflect light the way it's supposed to reflect. All right, so one of the things that I'm looking at when I'm evaluating this is, does it look even with the other teeth? Does it look the right height? Does it have the right light transmittance? Does it have the right fluorescence? Does it have the right contours? And one of the key things that we're doing on an anterior tooth is making sure that the little V that's in between the teeth, which is called an embrasure, is exactly the same as the tooth next door. So in this particular case, his main concern was on the incisal edge, or on the very edge of the tooth, and it didn't involve the embrasure, but all of his embrasures naturally were not too even. So afterwards, I did a little bit of extra contouring to make sure his embrasures were even, the contours around the outside and the embrasures in between the teeth, and that is the icing on the cake. The most satisfying moment in any dental procedure, is seeing the patient's approval afterwards, especially when you're doing anterior aesthetic restorations. When a patient can see that their smile was better than when they walked in, that is the best feeling in my heart. So key takeaways from this video are that we have a very simple problem, but it has major impact on a patient's smile. The next key takeaway is that the doctor has to know and have the materials and understanding to be able to do this. The other takeaway is that it can be cheap, non-painful, and very quick to do. And the other takeaway is that not every dentist has the ability, nor the materials, nor the machinery to be able to make this work well. All right, so I hope you enjoyed the video today. It really was fun doing this case. I loved seeing the smile on the patient's face when they left. If you have any questions about composite repairs or chips on your front teeth, make comments below and we can answer those questions. If you ever want to come in for a free consult, I'd be happy to do that for you if you have the same concerns in your mouth. Come to the Essential Dentist and we can take care of you.